Hello, my name is Lindsay and I am going to be recording a wound clean, irrigation, and dressing change today. First things first, what you would do is make sure that you assemble all of your materials. Right now on this side I have my PPE, I have a gauze sponge, I have my drape, irrigation tray, abdominal bandage, our sterile glove packet, and Q-tips, and tape already set aside and labeled with my name on it. And I would also look at the chart before I go into the patient's room, making sure that I know exactly what I'm going to be doing, where the wound is located, if there's any drains or anything like that sort. And just be aware of everything that I might come into contact with when I'm in the room. Before I go into the room, of course, I would want to perform hand hygiene. We would perform hand hygiene and apply our PPE. You guys asked that we do our PPE complete. So first we would put on their gown. Now, because this hasn't been in the patient's room yet, we do not have to be super concerned with touching the outside of the gown. However, when we exit the room, because of any kind of potential splashback or pathogens that the patient may be carrying, any isolation precautions, usually, which is why we're wearing this, we would not touch the outside of the gown. Tie the top first. And then tie the back next, making sure that we're tying it in the back. If we tie it in the front, that'll change our whole order of removing PPE at the end of the procedure. There we go. Okay, we would put our mask on next. Because I have a ponytail, I would secure this above the ponytail just to give it a little bit more leverage. I like to use a quick release tie. Boop. And then around the neck here, the bottom. After our mask, once I get this done, we would put our goggles over the mask, not under, and then we would put our gloves on. These are clean gloves, not sterile gloves. And then we would go in and identify the patient. We would ask their date of birth and their name. And then we would assess if they're in any kind of pain. If they are, we would administer either oral or IV, depending on what they've been allowed to or what the doctor's prescribed for them. Oral would take roughly 30 minutes for it to be fully active, whereas an IV about 15 minutes. You would ensure privacy. I know in the facility that I work in, each patient has their own room, so we'd close the room, or you would close the gown and then the curtains, and then you would get a waste receptacle, put it near us, and make sure that the patient is moved around so that you can access the wound. This is my fake wound with the bandage, and I'll have it here to the side. We would assemble all of our things. I know that we had like a T or L shape in lab, but I'm doing this right now in my kitchen, which is kind of an L shaped here. There's a little counter here next to the stove. You never want to turn your back on in a sterile field once you set it up. So the first thing here is that you would set up your equipment on the side. You would adjust the bed to the comfortable height. My countertop is around waist height, so that's okay right now. And then you would make sure that the patient is moved into a comfortable position so that you can access them. You will be pouring liquid into the wound, so we want to make sure that it doesn't get all over their clothes, their beds, and their sheets and whatnot. So making sure that they're comfortable, but also we're not getting stuff all over them would be ideal. You would check for any drains or tubes. I know some patients at my facility have wound vacs. We would need to be a bit more aware of that. Now at that point, we would put on our gloves. I put them on already, but this is when we put on our clean gloves, not our sterile gloves, and we would pull the bandage off. Doing so, going with the hair, not against, because that would hurt. I know at work also we use like a alcohol pad to kind of soften the adhesive. That works too. But you're pushing the skin down with one hand and pulling the bandage up with another. This is a bit messy because it is that's my wound. We would remove any kind of non-sterile equipment, and then we would note the color, odor, consistency, and amount of any kind of wound drainage. Is it serous? Is it singular? And so on and so forth. and then we would throw it away, but I need to reuse this, so I'm setting it over here to the side. Now that we've gotten rid of that, and we've assessed the wound, we would get a Q-tip, poke around the edges for any kind of tunneling, any kind of, what's that word? It's undermining. And then we'd measure it. The cool thing about these Q-tip doohickeys is that they do have measuring on the sides, so we can measure the length, which comes out to be around 120 millimeters. The width at the widest part, which comes out to about 40 millimeters. And then the depth, which you would use with your thumb, you'd stick it in the deepest part of the wound. It's about this much, and you'd measure that as well, which is about 20 millimeters. And you throw it all away. Toss, toss. Then we would remove these and perform hand hygiene. Hand hygiene. Actually, I'm gonna need these in just a second. So, all right, this is when we set up our sterile field. The first way to do so is by putting down a drape. This will be our field. You want to open it away from you, grabbing only the corners and tossing this outer part, only touching the edges as much as possible. Don't shake it because that'll disturb the air. And set it down. This is your sterile field. Get out of the way. Okay, don't touch the middle of the sterile field. And then you would put on all the things that you need for your sterile field. So we're gonna need Q-tips. Pretend this isn't open. Open it, toss it onto the sterile field. Do not cross the sterile field. You wanna toss it onto the sterile field. Our gauze. There we go. We'll keep this for our irrigation, so I'm just gonna set this over here to the side. Our abdominal pad. Pretending that it's here, we just boop. And then our irrigation tray, which we would use for irrigation, also gets tossed on there. We're going to use this for the draining, so I'm going to set this over next to the wound. At this point, we would use our saline and pour it into the small tray. So we'll pretend that we did that because I don't want to put any liquids near my phone and computer. Okay, we've got all of our stuff, but before we can touch anything in the sterile field, we would need to put on sterile gloves. So to do that, which is off camera for you, but I will still vocalize, make sure we have hand hygiene applied, and then with our non-dominant hand, we would take the cuff of the sterile glove and place our hand in it, pulling it as down as much as possible, then take our two gloves of our dominant hand, stick it into the cuff of the non-dominant hand, and pull down. Whew. Making sure that we're covering the gown, and we do the same over here. Pull down. Now we are sterile. We can touch the things within our sterile field. As soon as we touch something that is not on this drape, it is a clean hand, not a sterile hand. This hand will turn into a clean hand eventually. But first, let's set up our materials. So we're going to set up our syringe here. We have our Q-tip, and then we have our packing gauze. We're going to put some of our packing gauze into the irrigation tray with the saline solution in it. Boop, boop, boop. Okay, and now we're ready to go. So we're going to take our syringe and we're going to fill it from the tray with a liquid. And as soon as we touch this tray here underneath the wound, our hand is clean, so try not to touch anything that is sterile with this hand because that will no longer be sterile as well. We would use this syringe to wash the wound, so a steady stream applied about 1 inch above, and you'll keep doing this over and over again until the wound's draining and irrigation runs clear, making sure that you are catching as much liquid as possible. You can use a chuck as well to make sure it stays off the bedclothes, and so on and so forth. When you're done, put it back into its container, take your irrigation tray, remove it from your sterile field. We don't need it any longer. We would also just making sure we're taking note of anything that's going on in the wound here. And then we would dry it with our gauze sponge. Don't pick it up with your clean hand. I almost did that. You pick it up with your sterile hand because it's in the sterile field, and then give it to your clean hand and dry the wound properly, making sure we're thorough because moisture is where bacteria thrives. Throw it away. Okay. Now, once it is dry, we're going to take our wet sponge with our sterile hand. We're going to get it out of the water solution, and we're going to squeeze it out over the pan. And we're going to try and unravel it as best we can with just the one hand, which does take a bit. And once we have done so, we can hand it over to the clean hand for stuffing into the wound. We can use a sterile Q-tip to kind of secure it in place. Okay, and it's staying there, which is awesome. Then we'll throw the Q-tip away. Okay, at this point, when we apply the bandage, which unfortunately already has tape in it because I don't have another one. I have some tape set over at the side, but both hands are now clean, not sterile. We would apply the bandage onto the patient, take our tapes, apply along the edge, making sure there's no opening in the seams. We don't want anything to crawl into the wound. Four pieces of tape along each edge, making sure they're overlapping in each corner so there's an airtight seal for the wound. Okay, and then a smaller one at the end where you would mark your name and date when you did all the wound changing. Now you're done. So, removing your gloves, trying to stay on the outside of the gloves, and then reaching your hand underneath the cuff of the other. Remove those, get rid of them. You would remove your PPE. So after your gloves, you would remove your goggles. Your mask would be last. We would untie our gown, untie it around the back, untie the mask, my quick release knot, mask off, only touching the inside of the gown and rolling it away from you and disposing. And then that is PPE and sterile technique and full wound irrigation and bandage change. Thank you.